Health officials in India have confirmed cases of the deadly Nipah virus. And that's prompted authorities across Southeast Asia to boost security measures, including screenings at some airports. Now, the World Health Organization lists Nipah as a priority disease due to its potential for fast-moving outbreaks.
Traveller testings were a familiar sight during the COVID-19 pandemic. Now, a small outbreak of the deadly Nipah virus in India has prompted their return to several nearby countries, including here in Thailand. 2 cases of the virus were confirmed in India's West Bengal state in December. Carried by fruit bats and animals like pigs, Nipah can cause fever and brain inflammation. While not highly contagious, the virus has a high death rate.
You actually need very sustained long periods of close contact in order to actually get infected. But what makes it dangerous is the high case fatality rate. Like 40 to 70% of the people who get infected with Nipah virus will actually die from the infection.
There is no approved vaccine or cure for Nipah. Health authorities in India are not taking any chances, carrying out contact tracing of nearly 200 people. So far, there's no sign the virus has spread. And fears of a wider COVID-style outbreak appear unlikely at this stage.
In the case of the coronavirus, the reproduction number, meaning the number of people who will get infected by the time the one person who was infected recovers, was around between 2 and 3. And that's why the coronavirus spread so rapidly around the world. While in the case of Nipah virus, the reproduction number is much lower than 1.
But health authorities warn the virus could become much more transmissible and remain on high alert.
All right, I'm joined now by Dr. Kaja Abbas. He's Associate Professor of Infectious Disease Epidemiology and Dynamics at the London School of Hygiene and Tropical Medicine and Nagasaki University. He joins us tonight from Nagasaki in Japan. It's good to have you with us. This virus was first identified more than 25 years ago, and now the alarm is being raised. Why? Why has it taken so long?
I mean, since the discovery of this Nipah virus vaccine in 1999 and until now, there has been actually less than 750 cases globally. And when we say globally, it has been limited to primarily to 2 main countries, which is India and Bangladesh. While in 1999, there were a few outbreaks that took place in Singapore and Malaysia. But since 2001, in the last 25 years, mostly it has happened in India and Bangladesh. Very few cases. And the transmission of the infection and the virus is very limited. You actually need very sustained long periods of close contact in order to actually get infected. But what makes it dangerous is the high case fatality rate. Like 40 to 70% of the people who get infected with Nipah virus will actually die from the infection.
Wow.
And that's what makes this like highly dangerous, but the transmission risk is very low.
Well, I mean, it's good that you say that. And maybe if we could flesh that out a little bit. I mean, can you put this into perspective for us and maybe compare it to the coronavirus that, of course, everyone around the world knows all too well? I mean, are we talking about a threat at that level that we've all experienced?
No, not at all. Because in the case of the coronavirus, the reproduction number, meaning the number of people who will get infected by the time the one person who was infected recovers, was around between 2 and 3. And that's why the coronavirus spread so rapidly around the world. While in the case of Nipah virus, the reproduction number is much lower than 1. So if I'm infected, by the time I recover, I will actually transmit to less than 1%. It will actually automatically fade away quite quickly.
Okay.
So the risk is so far has been extremely limited, yeah.
And what about the push to develop a vaccine? Is that push not as strong because, as you say, it takes longer to transmit the virus from one person to the next?
That's a very good point in the sense Since the Ebola outbreak that took place, which affected like many other countries, especially in West Africa, one of the things we have realized is that we need to have vaccines developed even for pathogens that may currently at lower burden, but are likely to create larger epidemics in the future. So from that perspective, from epidemic and pandemic preparedness perspective, Nipah virus has been considered as a high priority pathogen because currently the reproduction number is less than 1, but in the future it can potentially mutate and become more transmissible, at which case it could be quite a deadly epidemic. So which is why it's a priority pathogen and part of several research networks, including the global CEPI network, which is a coalition for epidemic preparedness innovations, has prioritized development of Nipah vaccines. And there are several vaccine development pipelines are ongoing, but we don't have a vaccine yet so far developed.
Let me ask you before we run out of time, how confident are you that the steps being taken at this point are enough to prevent any really spread that could become an outbreak? I mean, we're seeing body temperature checks at airports right now. Is that enough in your opinion?
Yeah, even the transmission within India or even within the state of West Bengal, where it's currently occurring, is extremely limited. And for example, the 2 healthcare workers who are being like isolated and given or taken care of, and they have traced their contacts, almost 400 or like 200 contacts that they have been in contact, and they have been tested, and all of them have tested negative.
Good.
So the spread even within West Bengal, very locally, is actually extremely limited. And the chance of international spread is, it's not completely zero, but very, very, very unlikely.
Yeah, well, let's hope it remains that way. Dr. Kaja Abbas, we appreciate your time and your insights on a subject that I'm sure has got the attention of a lot of people tonight. Thank you.
Thank you for having me.